Hi, I'm Benny Calloway with IT Health Center. What I want to do today is give you a brief introduction of what IT Health Center is and what our purpose is with regards to your business. Well, IT Health Center is an IT company that specializes in supporting of home health care agencies, senior living facilities, even adult daycares, things of that nature. Our thing is, and our biggest reasoning as to why we look in this area of supporting home health care, senior living, adult daycares, etc., is because we know that there's a need. From what I've learned over the years, and I've been in IT for almost 20 years now, in this particular area, IT is not the primary focus. The primary focus in this is basically taking care of our elders, our seniors, or people who may be disabled and those who actually need assistance. At the same time, I also noticed too that IT is really on the back burner and a lot of times gets neglected. I had posted a question in Facebook not too long ago and put it out there. I'm part of a few different Facebook groups that cater to this area. And I asked, I'm like, what areas are basically things in IT that you think that have been neglected, or have you neglected? And the lady was like, what do you mean by neglected? Something that you haven't really focused on, something that you haven't deemed a priority. And if something were to happen, how would you handle it? Or did you handle it? Did you try to handle it yourself? So it's one of those things where, and I'm not trying to push blame or make people feel guilty, but it's like we all can't do everything. And if your focus is not working on your computers or working with backing up your computers, the biggest thing you don't want to do is have people's data on your machine crashes, or you don't have your computer secure and you get ransomware. That's not your focus. Your focus is taking care of patients. So why not partner with a company like IT Health Center to take that off your hands and actually give you a peace of mind that says, hey, I don't have to worry about this area because somebody else has our back with regards to this. And that is the reason why I created this company. It's one of the things where, like I said, we all wear many hats. I wear many hats dealing with this business as a small business. I just started it in 2024, even though, again, like I said, I have been working in IT for almost 20 years. And more so specifically, I've worked with home health care and senior living facilities for probably over 15 years. So I can't do everything, and neither can you guys. So I think this is a thing where it's a great opportunity for us to partner together to not only help one another grow, but actually be able to take your business to the next level. Because this is one of those ways where companies can level up by, number one, delegating the authority to somebody else who has better knowledge in a particular area so you can continue to grow your business. And that's why IT Health Center was created, or at least why one of the reasons that it was created. Another thing and or reason why I created this company, it goes back to my mother. My mother has Alzheimer's. Back in 2020, actually it started before 2020, probably maybe 2012 or so. I can't remember for sure, but she was diagnosed with early onset Alzheimer's. But over the years, as you know, with that disease, it increases and progresses. And 2020, with all the things that went on in the world in 2020, it got worse. And I think one of the things that made it worse at the time, and this is kind of her story, is that her brother had passed. This is basically her last surviving member of her immediate family. And we couldn't get there for the funeral. And I think around that time, she kind of went into a depression. People were stuck in the house or what have you. She wasn't eating. But there was just a lot of things, I think, that aided the decrease of her cognitive ability. And long story short, it got so bad to the point where I had to, unfortunately, step in and try to help her in a lot of different areas, help her with her finances, paying her bills, making sure that she had food. Then that got to the point where she couldn't drive, so I had to take her places. Then it got worse to the point where I had to enlist home health care providers to be there when I couldn't be there because I still had to work. But even in that experience, I noticed that there were some deficiencies. If it was no more than companies couldn't take digital payments. And that is something that's really primary in the current era of time that we live in, where you should be able to take a credit card from somebody. You should be able to have a way to pay online, some type of portal system, or even to the extreme of they didn't have sheets that were digital that you could sign to sign certain things. They had sheets for time sheets that were paper. And I'm like, I work 45 minutes from where my mother lives, and the carrier has to leave, and she needs me to sign a timesheet. I'm like, dude, I can't get where you are by the time that you need to leave. So I had to basically tell her, take a picture of that, text me the picture. I had to basically take that picture and convert it to a PDF. I had to upload it to DocuSign, sign it, save it as a PDF, and then email it back to her. So it's one of those things where it shouldn't be this hard, and it shouldn't be this hard for me to give you my money, or in that case, my mother's money, to pay them to come assist her. So that gets into the workflow automation portion of this. With the advent of AI, automation tools, things that you can use to make your job a lot easier, we can help you with that. We can help you with digital forms. We can help you with redundant tasks that you have to do over and over again. We can help you put together a system where if you have more than one worker in your office, if you have a team of 4 or 5 or more, and you don't have the ability to share files, we can help you with that. And here's the beautiful thing about all of this is, number one, most of this stuff can be done remotely, and we don't even have to be in the same state. When I worked with home healthcare facilities, I managed, I say, 2 companies that were clients of ours. And those companies, between the 2 of them, probably had about anywhere between 40 and 60 different facilities. And between those 2 companies, there were probably about anywhere between 450, 500, maybe a little more individuals that worked there that I had to manage. And I did all of that remotely. And every now and then, if it required someone to go on site there, I could contract with another company and they could go on site. And or depending on the severity of the situation, or if the company was building new facilities, I myself went there and helped set it up. But that was far fewer in between. I can count those probably on one hand. So my whole point is, we don't even have to be in the same vicinity of each other. We can do things remotely nowadays. It's all about, at that point, just having trust that we'll be able to handle the job and actually give you what you need to actually progress your business. So yeah, this is what IT Health Center is all about. I really just wanted to have a conversation and actually get the ball rolling and just kind of do an introductory video to kind of show what we are, or who we are, and what we're all about. With that, I'm probably going to make a few more videos to maybe talk about some more specific things dealing with your security, dealing with your backups. Do you have any? What are you doing for backups? What do you do in a situation where your hard drive crashes on your computer, where you lose your email? All those things can be prevented if you have some type of backup system in place. What are you doing as far as securing your computer accounts on your computers? Just because you might not have a large network, you still need some type of security. Do you have some type of antivirus or EDR, endpoint security, that protects you from ransomware, protects you from people clicking accidentally on a link? And it doesn't even take you to do it. Somebody that you send an email and communicate with, they could do it, and you end up getting infected by it because they send you an attachment and you don't really know that attachment was infected. So it's just certain things that we don't consider, and those things could basically take your business down. I recall one time there was a company that, and I'm not going to say the name of the company, and it was with the company that I worked for. We had a client, they had their own IT staff, and they said, we got this, we don't need to pay you guys for that. It turns out they said that they had a backup system. They did not. And they got ransomware. They didn't have a backup. And they contacted us to help. And we're like, there's nothing that we can do for you. You declined what we were offering. That company essentially had to go out of business and rebrand themselves and start a new business. Who wants to do that? So I say that as a cautionary tale, that there are things that can happen sometimes that we either are not aware of or even beyond our own control. But it's always good to have some type of stopgate or safety measure in place to actually recover from a situation like that may have occurred. But that is another topic for another day. With that, folks, I'm going to get out here. Again, my name is Benny Calloway of IT Health Center, and thanks for watching the video. Appreciate you. And hey, don't forget to like us on Facebook. We're on Instagram as well, and actually going to put this on YouTube at some point. So stay tuned, because there's a lot more things that we want to share and with the hopes of starting some relationships and maybe even having some conversations online. I don't know, we can do video, we can do just chatting through some of these groups, but the idea is to start conversations about what we do, what you need, some of the things that you may run into that you really don't have a solution for, or that you just deal with and work around and you shouldn't have to. So again, Benny Calloway, IT Health Center. You all have a great day.